Here today with Blaine Doyle. His company is Her Care. So what we have is an Irish guy living in Mexico City and running a business that seems to have found its place. Tell us a little bit about it.
Sure. So basically, I came to Mexico to supposed tackle cervical cancer screening. So that's what we wanted to get into. We started the lab in 2019. In September, we were actually opened this fully automated PCR laboratory to your home for cervical cancer screening in September 2019. And then 4 or 5 months later, we had COVID. So COVID was a piece of our story in terms of scaling our ability to kind of test people in Mexico City and then across Mexico. And from there now we've launched a clinic also. So right now we're positioning ourselves as a hybrid healthcare model for women in Mexico, and enabling people to not only get access to tests and vaccines in their home, but also do follow-up care through our clinics. So we have everything from gynecology to radiology, fertility, and oncology within these clinics. And now we're going from one clinic, which is currently profitable, to 30 clinics. And we're looking to do that in the next 5 years. So basically this network of clinics supported by back-end services. So we supply everything end to end.
Sounds like you've hit on something here.
Yeah, good fun. I think the population in Mexico and the way the economy is going right now is particularly interesting. And then looking to scale into Spanish-speaking United States. I mean, by 2030, 25% of the United States will be of Latin origin or Hispanic origin. So that's something we're really interested in.
When did you know that you had hit on something?
I think maybe it's kind of been a work in progress. I think like we had the turbulent years of COVID, and I think coming out of that, we've kind of realized that also Mexico's evolved. I think their perception of the of healthcare, I think that's really moved. I think everywhere in the world, but I think Mexico in particular, I see a big change from when I landed in Mexico to present day, and I think the focus on primary care and these other kind of movements of preventative care are really beginning to happen. So I think it's been an amazing journey, I think, right now. And I think we're really in a position where, basically scaling this thing is our number one priority.
Mm-hmm. So what, if anything, is standing in the way of you doing that? Or is this just a matter of time?
I think it's only a matter of time at this point. We've got good investors on board, our venture capital firms like SOSV. We've also got some interesting family offices on board who've basically got backgrounds in the med tech space and the healthcare space. So there's some good people behind us. And I think, we're talking with investors right now to raise funds to basically scale this from where we're at right now to basically, I suppose, going national in Mexico and pushing into the US.
Right. And I mean, you brought that up twice now, and that was where my brain went immediately, that this is, while not a completely novel concept, certainly better than what a lot of people are dealing with in a lot of places.
Sure, and I think bringing everything together gives you a certain level of understanding from I suppose a patient perspective, but two, also understanding your business from the commercial side. So I think that's something we really wanted to focus on was how can we bring everything together, and as a result, give ourselves, better patient metrics. So we're having better outcomes, better care for patients, but two, also better business metrics. So, our retention rates are better. Our ability to basically have better margins per patient as well are better. So it's kind of a win-win for bringing everything together. Mm-hmm. I think definitely, doing it piecemeal. So starting with the laboratory, having the luxury of scaling that during COVID was really helpful because it helped us to build a team around that. And now that's very, as it's process driven. It's obviously locally approved, the laboratory, but it's also got ISO registration, so we're internationally recognized. And so we've got that down to it's very process driven. The vaccines, we then began with that, and now we have the clinics. So at this point, we've kind of built it in such a way that it's very scalable. And in that sense, I suppose we've kind of managed to have the best of everything, vaccines, testing, and also the clinics.
Mm-hmm. So when you first proposed this idea to the people in charge locally, the ones that mm-hmm. could have a say in whether you're yes or no, what was their initial reaction?
In Mexico?
In Mexico.
Sure. I mean, so we're mainly focused right now on the private sector. So very much embedded there. I mean, we've got obviously all the relevant local approvals. So it's been, I think again, building the piece by piece part made it a lot easier. It made it a lot less friction. Had we probably come with the omnibus of things we have right now, it probably would have been a little bit more confusing. But we've managed to silo the businesses in such a way that they interact, but at the same time they do what they need to do separately. And I think that's important. But we've had no real friction locally, and we're beginning to look at now public projects in Mexico. To see what we can do in terms of impacting the wider population.
Right. Well, see, that's kind of where I was going to go.
Yeah.
You have the ability to affect a lot of lives in places where that level of healthcare clearly is not accessible.
Sure. No, and I think it's the beautiful thing about healthcare and being in these kind of businesses is, I mean, we can say, this year was a hugely successful year for the business, but on the flip side, I mean, we vaccinated 50,000 women against cervical cancer. So that's 50,000 women in Mexico we know will never ever have cervical cancer. So that's amazing, and that's in partnership with Merck. So they've been really, really helpful as well in helping us to build a business too.
Well, I can see why some of the bigger players would want to get involved because you've hit on something. I mean, you clearly, you've rung the bell, and now everybody's responding.
Exactly, that's it.
Yeah. Well, congratulations.
Thank you so much.
Yeah. Good luck moving forward, Blaine, and wish you all the best.
Excellent. Thank you so much.
Thank you.